Hello, my name is Deanna Garcia. I'm the Public Information Officer to the Unified Command currently responding to the COVID-19 pandemic. Today I'd like to go over the COVID-19 Risk Index. And this index sort of gives you a picture of what is considered a high-risk activity versus a low-risk activity. And there are four main components that go into determining whether an activity is a high risk, a low risk, or somewhere in between. Risk levels for exposure are varied based on four factors: enclosed spaces, duration of interaction, the crowds or the density of the people within that area, and the challenges for physical distancing. The last factor is forceful exhalation. So singing, coughing, yelling, sneezing, those are things that require you to exhale with more force. So let's start off with the high risk category. So for our first activity, we have bars and nightclubs. So the risks associated with bars and nightclubs are that you are in an enclosed space, you have prolonged close contact with other people and the potential for clustering, and then you have a high respiratory rate and you're yelling or talking loudly amongst your friends, trying to talk over the crowd. Another thing to consider about bars and nightclubs is the consumption of alcohol and the lowered inhibition, which might cause you to ignore some of the safety guidances that are currently out, such as washing your hands or wearing your mask or maintaining that physical distance. The next category on the list is an indoor party. Indoor parties, the risks associated with an indoor party is that you are in a closed space. You have prolonged close contact and the potential clustering of people. Much like with the bars, you also have the consumption of alcohol and the lowered inhibition. Another risk of a party in general is that if you're sharing a joint or a mouthpiece or a cigarette or a vape pen, you risk that potential of spreading germs that way. The next activity on the list is plain contact sports. Plain contact sports is high risk because you are in close proximity to other people. You have the potential clustering of people, and you have a high respiratory rate, which causes you to breathe heavier. So being that you're so close to people, you're breathing heavy, they're breathing heavy, you guys are just circulating air with each other. The next category on the list, or activity on the list, is movie theaters. Movie theaters are considered high risk because you are in an enclosed space, in close proximity to other people for a prolonged period of time, and you also have the potential for clustering, along with high-touch surfaces. The next activity is air travel. Air travel is considered high risk because you are in a close proximity to people for a prolonged period of time. There's a potential clustering of people as you board the plane at the gate, and because of the high touch surfaces on airplanes. While airlines are doing their best to make sure that the planes are cleaned, they're not always cleaned as much as we would like them to be. The next activity on the list is religious services. And religious services are a high risk because you're in an enclosed space for a prolonged period of time, and there's the potential for clustering. There are also high-touch surfaces at religious services, as well as singing or the projection of the voice. Again, there's that forced exhalation of air that has the potential to circulate germs. The next activity on the list is concerts. Concerts are considered high risk because you are in close proximity with the potential of clustering of people. There are a lot of high-touch surfaces at concerts and the projection or the yelling. Again, forced air exhalation. And the last activity on this list is watching sports. Watching sports isn't necessarily high risk if you're at home with the people who live in your household. It's when you go out to a sports bar or you're at a friend's house with a lot of other people that you don't normally interact with. You don't know if they're following safety guidelines, and you're there in close proximity, maybe have the potential for clustering. and you're cheering your team on. So again, forceful exhalation. So then we'll move on to the medium high risk category. For this category, the first activity on the list is exercising at a gym. The risks associated with this are that it's indoors, you have close contact and the potential clustering of people, high touch surfaces, it is also difficult to wear a mask, and you have a high respiratory rate here. You're working out, you're breathing heavy, you're moving around, again, forceful exhalation. Next is hair nail salons and barbershops. The risks associated with this are that you are in close contact with another person in an enclosed space, and it's difficult to wear a mask while you're doing these, especially getting a haircut. The next activity on the list is working in an office. Working in an office is high risk because it's indoors, you have high touch surfaces, prolonged close contact, and potential clustering of people. A good way to ensure that our workspaces stay safe is to maintain physical distancing, to wash our hands as frequently as possible, and to wear a mask. Also, another good thing to do is to clean your work surface before you move on to the next task so that the next person has a clean working space. And the last activity on this list is indoor restaurants or coffee shops. The risks associated with this are that it's indoors, you have a prolonged period of close contact with other individuals, you have the potential clustering of people, and it's difficult to wear a mask while you're eating and drinking. As you can imagine, in a restaurant, we don't often eat in silence, so we're going to be talking while we eat, and that, again, no mask and that forceful exhalation makes this activity a medium high risk. The next category on the list is medium. The first activity in the medium category is visiting a hospital or emergency room. And the risks associated with this are that it's indoors and you have the potential clustering of people. That isn't to say if you get seriously injured or sick that you shouldn't go to the hospital, but maybe for those smaller cuts and bruises that can be cleaned up at home, you take care of those at home instead of going to a hospital. And the next activity on the list is medical offices. The risks associated with this are that it's indoors, you're in close proximity to other people, and you have the potential clustering of people depending on how many people your doctor's office is allowing in. And there are a lot of high-touch surfaces here. Most doctors now are offering telehealth via the telephone or computer, so sometimes they may ask you to stay home and log on or call in to meet with them, and other times they may ask you to come in for a physical in-person appointment. Depending on your doctor, you can discuss your options with them. The next activity in the medium category is dental office visits. And the risks associated with this are that it's indoors, there's close contact, and again, much like the doctor's office, a potential clustering of people depending on how many patients that doctor is allowing in the waiting room. And the other risk associated with dental visits is that the patient is not wearing a mask. And the last activity in this category is outdoor dining at a restaurant. The risks associated with this are that you have the potential clustering of people and that you have a challenge wearing a mask while eating. While this is a little bit safer than being in an indoor restaurant, there are still risks associated with it. The first activity in the low-medium category is grocery shopping. Grocery shopping, the risks associated with this are that it is indoors, you're in close contact with people with the potential clustering of individuals, as well as the high-touch surfaces. The cart is a high-touch surface along with the door handles on the freezers and then the pin pads. So it's always good to carry hand sanitizer when you're going to the grocery store, and make sure you're washing your fruits and vegetables off when you get home. The next activity on this list is retail shopping. The risks associated with retail shopping are that it's indoors, you have close contact with people, and you have the potential clustering of people. While retail shopping is in the low-medium category now, it does have the potential to move up into a higher category as we head into the holiday season and more individuals are out shopping. Right now, a lot of people are doing online ordering and having things delivered to their homes, or they're doing online order for pickup where you place your order online and then you go to the store and pick up there. These are great options for avoiding crowds. And as we head into the holiday season, might be options you want to look at. And the last category we'll go over is the low category. The first activity in the low category is staying at home, alone or with the members of your household. Walking outdoors with or without pets. Biking or running alone or with another person. If you're going to do biking or running with another person or friends, just make sure you're maintaining that physical distance. Otherwise, you're outside and there are lower risks there. Picking up takeout food, coffee, or groceries from stores. And the risks associated with this are that you have close contact and the potential clustering of people. Maybe you're waiting in line and people aren't physical distancing the way they should be, but this activity is a relatively low risk activity. Now, all of the activities here from the high category all the way down to the low category have the potential to move categories based on safety precautions that individuals are taking, but also safety precautions that stores or places of business are taking. So something that's in the low category may move up to the high category if the proper etiquette is not being maintained. And an activity from the high category or even one from the medium category has the potential to move down to the low category, again based on procedures and guidelines and individual precautions that are being taken. A good rule of thumb to remember while you're out participating in any one of these activities is crowded, closed, confined spaces, the 3 C's. If an activity is in a crowded, closed, and confined space, it's going to fall into the high risk category. If an activity is not in a crowded, closed, and confined space, it's going to fall into the lower risk category. Protect yourself and others from COVID-19. Wash your hands with soap and water, or use hand sanitizer that contains at least 60% alcohol. Cover your coughs and sneezes. Avoid close contact and maintain physical distancing. Cover your mouth and nose with a mask when you're around others or in public spaces. If you have any questions or concerns or would like to be tested for COVID-19, please contact the Tohono O'odham Nation Healthcare. The cell's office can be reached at 520-383-7209. The San Simon Clinic can be reached at 520-362-7078. The Sanavir Clinic can be reached at 520-295-2529 or 520-295-2590. Again, my name is Deanna Garcia. Thank you for joining me today to go over the COVID-19 Risk Index. Have a great day.